Dr. John Spencer, and welcome to STEM Forward, a podcast where we take you on a journey through science, technology, engineering, and math to explore career opportunities and other insights to shape your future.
Hi, I'm Dr. Stephen Jones, and today we're diving into the fascinating world of epidemiology, a field critical to public health, and we want to spotlight some of the recent activity around epidemiology. And epidemiologists do become, we want you to become one. The job outlook and the course opportunities are vast.
Yeah, epidemiology is definitely a mouthful, Steve. So, in thinking about this, right now we're a couple days away from New Year's Day, first part of winter. And, we're right in the thick of cold and flu season. Some will even say we're right in the middle of COVID season. So when you think about epidemiology, one of the things that they deal with are the threats of infectious disease, environmental risk that are on the horizon. The role of the epidemiologist is more important than ever. If you think about it, 4 years ago, we were coming out, maybe almost 5 years ago, we're rolling out of 2019, we're rolling into 2020. Everybody's optimistic, then we get to March. And like, what in the world is going on? People are getting sick. They don't know what's happening. Then March 13th comes and, we're being told to stay home. And that ended up, seems like a year we were back in our houses. So this episode, we're going to explore how can you become an epidemiologist to find a career path that's rewarding, especially if you're interested in solving problems and you love science and think that'll be a good career with you. So let's start with the basics. What do epidemiologists do, Steve?
Epidemiologists are public health professionals who study the patterns and causes of diseases and injuries to people. They play a critical role in identifying health risks, tracking outbreaks, finding ways to prevent and treat diseases. They collect and analyze data and also surveys and interviews. I remember you were just talking about COVID. I'm not sure whether I had it or not, or I had the flu at the very beginning of it, but I just remember a week where I was just kind of really weak and coughy and, congested. So, there was the beginning of it, and then it just blossomed from there. But these are things that epidemiologists help us to determine and help us to come up with some solutions as we're dealing with the sick and injured.
And you're right. It's just not about research. It's about communicating findings to health practitioners, the general public, and policymakers. They may supervise teams, manage public health programs, and even write grants, proposals, secure funding for public and private studies. You made me think. I remember in 2019, in the fall, I was reading I want to say it was the Wall Street Journal. Was the first time that I was hearing something about an outbreak, and because people were trying to buy these scarves where you could put filters in it to cover it, and they had gone out of stock, and there were some supply chain issues with the types of filters. So that's the first time I kind of heard something was going on. And just like you, I got sick at the end of December, early January, and my doctor couldn't tell me what it was. And the same thing with my children. It wasn't until almost 3 months later that they actually put a name on it.
Right.
And so go ahead.
No, I was going to say, and then people had to accept that there was something going on. That was a whole nother level of it.
So that's where the communication and the public policy, comes into play. Where epidemiologists can have a big impact on shaping, the public's knowledge of what's going on, because there's a lot of disinformation out there, a lot of non-science being used.
And some of it is for convenience rather than addressing the issue.
Hmm.
So I think you're absolutely right. We need more epidemiologists. People are always going in and out of professions, so um, they deal with the chronic diseases and mental health and infectious diseases. They can work in different environments and hospitals, local health departments. They work with the federal government on public health emergencies. Their work varies depending on the specialization and even how much they travel, around the country in various areas of the country to determine the linkages and connections of what's happening in diseases.
Hmm. One thing I often wonder, because we have grown up in a society where travel is relatively easy. Um, Remember, I forget the story's name, but like 100 days or 80 days around the world. You remember that story?
Yes.
Um, but now you can go from, say, California to Egypt in a day on an airplane.
Hmm.
So you're transversing thousands of miles. So when you think about infectious disease and things of that matter, just because you live in one place doesn't mean, you're isolated from
Hmm.
that particular disease. So when I think about the possible career path of epidemiology, you can become a globe trotter. It sounds like a very dynamic job. But what kind of education and training would you need to become an epidemiologist?
Well, the epidemiologists typically need at least a master's degree, often in public health and emphasis on epidemiology. Some even pursue a PhD or medical degree to specialize in research or even work in a clinical setting. And I just want to say to anyone that's listening, I know that 2 more or 5 more additional years of education seems like a lot, but it will go by really, really faster than you think it is. And then you'll be launched out into the world to make a difference. So if you're thinking about it, and you have the energy, I would say definitely get the education for the opportunity.
Well, one thing I tell my students, Steve, the more education, more money. And one thing I want to make clear to our listeners, we're not just necessarily talking about like college education, college degrees. I'm talking about going to whether it's trade school or community college, but having the credential that licenses you or prepares you to do a job. Because leading up to epidemiologists, there are whole industries and sections of healthcare that you can do with a either certificate or through an associate's degree from a community college. So
Mhm.
there's a lot of different types of training to be involved, but it's clear that epidemiologists have a major impact on public health. So before we move on, don't forget to subscribe to our YouTube channel, subscribe to STEM4 for more insightful episodes, and share our podcast with others interested in careers in STEM that impact health and society.
Do you want your students to earn excellent grades? This is Dr. Stephen Jones, author of 7 Secrets of How to Study, the nationally recognized book, and my online course. The students in your organization can earn A+ grades in just a few hours. Get the 7 Secrets of How to Study course for your students. You won't regret it. At how we can become one. As mentioned earlier, a master's degree is required, and it's a growing field. It's big, it's a detailed profession, and an ongoing learning profession. So even though you have your degrees, you'll continue to learn and continue to grow inside the profession.
To get into a graduate program, you need a bachelor's degree in a related field such as biology, social sciences, public health. And from there, your studies will include public health, statistics, and the biological sciences. So one of the things that I want to say to our viewers and prospective epidemiologists and STEM career path students, don't be afraid to think about graduate school and life beyond the bachelor's degree. You know, when you're trying to set on the path for a professional career, know that there are various educational milestones, and the bachelor's degree in many of the professional fields is just the beginning. I know when I talk to my K to 12 students and I say, you know, well, I went to school 12 years beyond high school, they're like, oh my God, Dr. Spencer, are you serious? I'm like, yes, it has been very rewarding, you know. So that's something that you have to think about when you look at these various STEM careers. And like I said in the last segment, if you even think about community college in the beginning or trade school, you know, once you're in it for a while and you're looking for career advancement, one of the ways to make career advancement is getting additional credentials through education.
Well, you going back to that whole conversation about the study of it, and you mentioned in that statistics. And so, for those who also have a joy of math, you can combine the sciences with public health and statistics and tell your story with that math. So I think for those of you who are just looking for more of a challenge, this is another opportunity that can help you with that, and you can help others as you do it. Um, you'll also likely need to complete some internships and practicums during the graduate studies, more of that hands-on experience, and taking the book knowledge that you have and actually apply it makes it a lot more engaging, fun, for you to think about what you're doing and where you're headed, and an opportunity to ask a lot of questions. I think that's so important as you're going to be an epidemiologist that you're going to have to ask a lot of questions so you can be at the top of your game. But like I said, their hands-on experiences, is partnerships with organizations like the Center for Disease Control and Prevention, the National Institutes of Health, and an incredible opportunity to gain real-world experience by interacting with people who are already in the field and having them as mentors and as resources as you're moving into profession.
Hmm. Hmm. You know, some epidemiologists even pursue a PhD or a medical degree, especially if they want to focus on research. Like we said, you know, the path is not sure. We both went on that path to receive our terminal degrees and our doctorates, but, you know, it's very impactful on our careers.
And the skills required for the job are just as critical as the education. Epidemiologists need to be strong communicators, ability to relay findings. They need to be clear with their critical thinking, problem solving, decision making. They're sounding like engineers in a way. They have a keen eye for detail. Plus, you've got to be good with the data and have a solid grasp of statistics and data analysis is crucial, and you're helping people to stay alive. So I think it's really critical that epidemiologists put out good information that will benefit all of those who are in the medical field.
Hmm. So since we were talking about data, let's pull up this little map here of the United States. So this is the 2024-2025 influenza season week 51 ending December 21st. So this is the current activity level, and it goes from insufficient data, which is the Virgin Islands and Alaska, to very high activity, which is Louisiana and I believe Oregon. But just look at all this red
Mm-hmm.
in terms of influenza cases around the country.
Mm-hmm.
you know. And so I know in our school, one of the things we still talk about is making sure you're washing your hands. And if your sickness has, reached a certain level, don't come to school because we
Mm-hmm.
don't want the spread of the flu and other illnesses to impact the whole school community. But I'm really surprised looking at this map how red um, many of the states are.
Mm-hmm.
Uh, Let me see, our current states, and we're at a low level of activity of influenza. So I guess that's good for us, but a good chunk of the country um, has, they're in this high range. And that's something,
Yeah.
you got a couple chunks that are in this very high range.
You
Very
know, a
high.
lot of the states, the weather is changing up and going back and forth, and cold and warm, and people are going out in their coats and coming, um,
Hmm.
indoors, and just it's just strange here right now. It's almost January, and it's 60 some degrees here.
And it was like 16 degrees last week. So it went from 16 degrees. Now we're at 60 degrees. But that's a whole another conversation
Yeah.
on on climate, you know. But yeah. I guess climate would have an impact on how diseases and different things are transmitted, and because the
Hmm.
more you're around people, the more probability of you maybe catching something, especially if
Hmm.
people aren't washing their hands. That was one of the biggest revelations to me um, with COVID, just understanding how many people, just simple hygiene of washing their hands.
Yes.
Where I grew up in
Yeah.
a household, you know, always washing hands and making
Yes.
sure things were clean and things like that. Um, but yeah, that's why communication skills, critical thinking, solving problems, and having a keen eye for detail, because somebody had um, to crunch the data, make up the queries to develop this chart and pull together the report. And this is
Hmm.
something that seems like they're doing weekly on the CDC site, um, Center for Disease Control. Um, And the amazing thing, looking at those numbers, the flu vaccine has been around for ages. So the question I was starting to wonder how many people are actually getting the flu vaccine or getting the
Exactly.
COVID boosters at this point.
Exactly.
You
That's
know,
a big question.
hmm yeah. But it definitely sounds like a great opportunity for those who love science and complex problems. And before we move to our next part of our discussion about epidemiology, remember STEM Forward. Make sure you click the subscribe button. Make sure you are sharing this podcast with anyone that wants to pursue careers in public health, and to people that are just involved in or wanting to find out more about STEM as a possible career field. Are you a solo entrepreneur, entrepreneur, or small business owner looking to establish a strong online presence? At Teach It Labs, we specialize in creating mobile-friendly websites tailored just for you. Our customizable templates are easy to showcase your brand without any coding experience. Plus, with our learning management systems hosting, delivering educational content online has never been simpler. Ready to elevate your business? Visit teachitlabs.com and let's build your digital future together. So, welcome back. So, we talked about how to become an epidemiologist. We talked about some of the things that they do, but what is the job outlook? Because the whole purpose of us doing STEM Forward is to try to introduce K to 12 students and families and even people in higher ed to various career paths in STEM. And so one of the things we, want to make sure people understand is what is the economic benefit? What is the money that is going to go into your pocket as a result of studying this field? Because if we don't talk about economic sustainability and how these various careers that we spotlight can help you live a fulfilling life and impact the community as well, we'd be doing a disservice to the various communities that we represent. So, Steve, what does the future hold for this field?
Well, I have great news, and that's that the demand for epidemiologists is expected to grow, expand, and it will be significant. The U.S. Bureau of Labor Statistics projects that 19% growth in employment from 2023 to 2033. And the amazing part of that is that some of you are in high school right now, you're within this 10-year window. So you may be saying to yourself, well, I'm only a high school student. But you go off, you go to college, you're there for 4 years, you do a master's degree, you're still within the window of this opportunity. Or if you're already in undergraduate school, you're really within the window of this opportunity. So I would say you want to be in a profession that's going to be growing, expanding, and with all the new technology and AI, it's going to be phenomenally growing within the whole technology space as well.
Mm-hmm.
It's one of the fastest occupations that's happening right now, and I think it's great news to consider a career.
So, like one of the things you just mentioned, artificial intelligence, and one of the things um, when I have conversations, whether it's my K to 12 students or my students in graduate school, I believe AI is a great tool, but if you don't understand um, what you're researching, what you're looking up, and have an understanding of it, with AI's ability to hallucinate and to provide incorrect information because it is trying to please the user, there could be a lot of disinformation. And so
Mhm.
that's where the research part of um, the epidemiologist becomes so important. So one of the reasons that there's considered to be a growth in this field is because there's so many people expected to retire and to transition from
Mhm.
other fields. So that's why there's so much opportunity because as the baby boomers continue to retire and Generation X gets older, um, that there's going to be a big gap in terms of people filling various fields, especially in STEM, that's going to be
Mhm.
out there for the taking.
That's true. And you want to make a living wage. So the median annual wage for epidemiologists in 2023 was $81,390, with the highest paid epidemiologist making over $132,000 yearly. However, it can vary from state to state in terms and from the organization that you're working within in terms of salary opportunity and development of the median salary of about 115,660, while those in local government or public health roles earn somewhat less. So just
Man,
selecting the place where you fit can create the top opportunity and the income that you're looking for.
and that's definitely a livable wage. It'll vary, cost of living depending on, what part of the country that you choose to live in. But with many making over 132,000 and the median salary being 115, that is worth the investment of your time and education. So, okay, you got that good salary, but what are the work conditions like? It really depends. It varies. Many work in offices or lab, but there's also field work that might require you to travel to different communities. Like we just put up this the influenza map. You might have to
Mm.
go to communities to help out what's going on, or even other countries where there may be a public health issue. But while field work can involve irregular hours, most epidemiologists work full time on a standard schedule. So that's, not a regular 9 to 5, but it's pretty fair compensation for that
Yeah.
9 to 5.
And today everybody's in this work-life balance kind of how they're doing jobs. So depending on the kind of um, opportunity that you're investing your work in, you never know whether it's a nonprofit, or government or education institution. I will say that the universities need people to teach epidemiology. So that is another opportunity when we look at it. If you get out onto the field, maybe you could do some research in connection with universities. That's a very um, great opportunity that I've seen happen across institutions and hospitals, and it's been great that way. The government working with the colleges and their epidemiologists working with them. I know during again back talk about COVID, we had developed there was a big problem with individuals in the hospital and breathing, and so we were working on an apparatus that was cheaper that could be produced faster. And so we had to have probably conversations with epidemiologists and others to develop what we developed at Villanova University.
Mhm.
So I think it's important not to forget that this is a positive field where you're going to do wonderful things. You're going to be helping manage the public crises, researching diseases and prevention, analyzing data, saving lives. Epidemiologists' work is critical to improving health outcomes globally. And so we may be looking at the United States, but as Dr. Spencer said, you might travel outside of the United States to do some research on things that may be transported around the globe, which makes it even more interesting. And if you have some language skills that also would benefit you as you travel across the globe and interact with some researchers from other countries.
Yeah, most definitely. I mean, this definitely sounds like a very rewarding career. And as I said before, our hope at STEM Forward is to make sure we're exposing you to different fields of study and different career paths that you might not have heard of before. So please make sure you share this podcast with someone that, like we said, that is interested in science, technology, engineering, and math.
Mhm.
Steve, before we go, any final thoughts?
Well, as you just said, we would love for you to consider this as an option for a career, and it's something that you could do for a long time. Also, I'm always talking about career development, so you can develop yourself as you're interacting with people in the field, and just keep it as a fantastic opportunity for yourself. Um, the public health is in need of professionals. It's a fantastic growing field. The world will always need a skilled epidemiologist to combat emerging health threats. And again, talking about conditions are changing globally. And so you want to be a part of the solution.
Steve, you got to turn your camera back on.
I don't know how that happened.
I'm not sure what happened, but hey,
Yeah.
it's a live broadcast, so to speak, and so things happen. You know. um, so great, great, great. So as we close out our episode today, once again, thank you for watching, listening to STEM Forward. Remember to subscribe, share, and keep exploring this exciting world of STEM careers with us. And until next time, I'm Dr. John Spencer.
And I'm Dr. Stephen Jones. Thank you for joining us.
Thank you for tuning in to STEM Forward. For more information about this episode, visit our website and check out the show notes.